Good afternoon, everyone. Thank you, Sushree, for the splendid introductions. First and foremost, I extend a heartfelt welcome to all attendees of today's distinctive webinar. I am Dr. Gopal Purohit, the CEO and co-founder of Heredity Biosciences and the convener of this webinar. It is a pleasure to have each and every one of you joining us today. In today's webinar, we investigate into the transformative domain of digital transformation in healthcare. Digital transformation in healthcare involves investigating a technology to enhance patient outcome, streamline processes, and improve efficacy. From electronic health records and telemedicines of artificial intelligence and wearable digital solutions are revolutionize how healthcare is assisted and deliver, ultimately leading to better patient outcomes. A sincere thank to our esteemed guest speaker, Dr. Sahar Qazi, a scientist in the field of bioinformatics at the Department of Biochemistry, All India Institute of Medical Science, Delhi. Your acceptance of our invitations has greatly enriched today's webinar, and the entire Heredity Biosciences team is truly grateful for your presence and expertise. Dr. Qazi, your valuable contributions has significantly elevated the quality of our webinar. Thank you for being an integral part of this insightful session. Now, audience, the highlight of this webinar sessions. Today's webinar is centered around the intricate study of digital transformation in healthcare. It is rapidly gaining movement across industries globally. The projection indicate that global spending on digital transformations initiative will surge to $3.4 trillion by 2026, making a substantial increase from $1.6 trillion in 2022. This exponential growth underscores the widespread adaptations of digital technology and the profound impact they are expected to have on business, economics, and societies worldwide. This rapid growth shows that digital initiatives are being prioritized as essential in almost every industry, and healthcare is no exceptions. Now, the question is that what is digital transformation in healthcare? So, in healthcare, it involves leveraging fashionable technology, methodologies, and processes to deliver sustainable value to patients, healthcare professionals, and organizations. It encompasses the adaptations of advanced technologies and innovations approaches to maximize benefits, with key goals include improved patient outcomes, cost reductions, increased accessibility, and enhanced experience for all stakeholders. Today, an increasing number of healthcare providers are embracing digital transformations to drive positive changes. So the strategic and reports in trends, according to the reports of future market strategies, the global digital transformations in healthcare market is projected to around $65.2 billion by 2023 and is expected to grow to $253.6 billion by 2033. A recent data study found that approximately 92% of healthcare professionals and institutes experienced improved performance as a result of its digital transformation initiative. These figures underscore the significant impact and growth important of digital transformation in reshape the healthcare landscape and improving overall patient care. Now, continue from the highlight what is the benefits of digital transformations for patients. In digital offer significant advantage to patients through various digital healthcare solutions. First one is better and more personalized service, like digital transformation enables more accurate health diagnosis and personalized treatment plans to individual patient needs. Second one is better communications with the doctors. Patients can access professional healthcare services online through video chats, mm, chat platforms, and emails, facilitating clear communication with the healthcare providers. Easy access to personal health data, like patients can conventionally assess and manage their personal health record online, allowing for the analysis of health metrics and history. Fourth one is convenient appointment scheduling. Digital transformation allows patients to schedule doctor appointment either conventional through the online platform and need to the phone calls or in persons to the visitors. Fifth one is track health metrics in real times. So advanced technology such as healthcare wearable devices enables patients to monitor important health metrics in real times, providing valuable insight into their health status. Sixth one is very important one, that is enhanced patient engagement. Digital health tools empower patients to actively participate in managing their health by assessing their records, connecting their providers, and using data to make informed decisions about their care. This increased engagement lead to better health outcomes. Benefits now, the benefits of digital transformations of healthcare institute and organizations. Digital transformation in healthcare bring about various advantages for healthcare institutes and organizations, like reduced cost, like process, or it's a process outcomes enabled by digital transformation allows healthcare organizations to offer cost-effective services and eliminate unnecessary spending associated with traditional and healthcare practices. Second one is optimized workflow. So it is replaced by the paperwork with the digital records, reducing patients' examinations times and providing easier access to patient health records. This streamlines workflow processes and improve efficacy. Third one is improved interactions with patients. Digital transformation facilitates improve and more effective online interaction with patients through video calls and chat, enhancing communication and accessibility to healthcare services. Fourth one is secure databases for electronic medical records. Uh, this is the enable the creation of a secure databases for encyclopeding, storing and assessing provide medical records of patients. Thus allows for on-demand sharing of records with healthcare professionals, laboratories, and medical specialists while ensuring data privacy and security. Fifth one is enhancing decision making. Digital transformation provides healthcare organizations with access to more complete, timely, and accurate patient data. This enables better clinical decision making and care coordinations among providers, ultimately providing patients outcome and satisfaction. I'm collecting for these Google databases for top 7 digital transformation trends in healthcare, like healthcare wearables, patient portals, data aggregations, telehealth and visual doctor visits, on-demand healthcare, disease history analysis. 7 one is AI screening. This all are is easy to improve the patient outcomes. Now, audience, before introducing to our guest, to allow me to brief about this company overview, like Heredity Biosciences. Heredity established in 2018 and rebounded in 2021. Heredity Biosciences is a premier provider of research and training services for hospitals, life sciences institute, and pharmaceutical firms. It is trusted in the medical and scientific community. Our sessions team specialize in genomics, proteomics, and bioinformatics. We are committed to quality and armed with a cutting-edge technology. Our collaboration with the Heric Life Sciences Private Limited drive impactful innovations in global life sciences and healthcare research. Heredity Biosciences proudly operate from two locations. First one, as you know, that we are in Mayfair Lagoon Road, Bhubaneswar, and new branch in Guwahati, Assam, inaugurated last year. This expansions significant milestone reflecting process and growth, bolstering our capabilities and fostering collaboration with the local institutes, research institute, and different research organizations. We anticipate meaningful contributions to advancing life sciences through these exciting expansions. So Heredity Biosciences, as you know, that we are providing for the life sciences as well as for the healthcare services, comprehensive research and training services also. Our life sciences service covering genomics, proteomics, and metabolomics, accessible in national wide. In healthcare research services, we are investigate crucial areas like clinical microbiology, infection genetics, cancer genetics, uh, fertility genetics, and conventional PCR-based DNA studies. That's where our website. So today, we are proud to announce an exciting to share media, instruments, and consumables distribution collaborations between Heredity Biosciences and Copper Surgicals, a global leader in assisted reproductive technology solutions. Origio is a part of Copper Surgicals, has been at the forefront of delivering innovations ART worldwide with a combined product range including pipettes, media, and andrology products. We offer a comprehensive tools to support ART professionals in this work. So, by partnering this copper surgicals, Heredity Biosciences aim to advantage their global network and industry-leading ART innovations to further enhance customer access uh, and offer next-generation solutions to the entire IVF processes. So thank you for this collaboration. So we will be doing the fruitful Heredity Bioacademy, Odisha's premier training institute, offer comprehensive hands-on research training for students and professionals. We have a specialized modules include clinical embryology, histochemistry and immunohistochemistry, and qPCR and genetic diagnosis. Our personalized dissertation program provides unparalleled exposure to advanced laboratory practice, preparing students for the dynamic landscape of biosciences. So join us Heredity Biosciences and board and journey and combine academic accuracy with hands-on application, empowering you to become a future leaders in the field of life sciences. In the past 3 to 6 months, Heredity Biosciences has witnessed a successful sphere of placement activities. Over the last 3 months, numerous students completed their training and secure posts in esteemed establishment, including fertility clinic and pharmaceutical companies. These achievements stand as a testament to the effectiveness of our training program. We extend our heartfelt congratulations to all these students and to wish them to journey fulfilled with prosperity and fulfillment in their growing careers. May their contribution to the field of biosciences and healthcare be impactful and rewarding. Cheers to the success for future ahead. Heredity Biosciences is actively involved in research across the various fields of life sciences and healthcare. Our researchers have contributed to numerous publications in peer-reviewed journals covering a wide range of topics, including genomics, proteomics, metabolomics, clinical microbiology, infection genetics, cancer genetics, fertility genetics, and conventional PCR-based DNA studies. Our research efforts are aimed at advancing scientific knowledge, developing innovative technologies, and addressing key challenges in healthcare. We are committed to publishing our finding in review journals to share our knowledge and contribute to scientific community. Ladies and gentlemen, it is a great pleasure with I introduce our esteemed guest speaker for today's webinar, Dr. Sahir Qazi. Dr. Qazi is currently a scientist B in the field of bioinformatics in the Department of Biochemistry, All India Institute of Medical Science in New Delhi. Her academic journey stands as a testament to her unwavering dedications in the field of medical science. Dr. Sahir Qazi completed her PhD in bioinformatics from the Department of Computer Science at Jamia Millia Islamia, New Delhi, between 2019 to 2022. Prior to her doctoral studies, she earned her MSc in bioinformatics from the same institute between 2016 and 2018. Her academic journey began with a BSc in botany from the University of Delhi, where she demonstrated a keen interest in the biological science, graduating in 2016. Dr. Qazi's research interests encompass a wide range of fields, including translational bioinformatics, cancer biology, epigenetics, artificial intelligence in medicines, computer-aided drug designing, and biological data analysis. Her commitment to advance in this area is evidenced in her impressive publications record. She has authored 22 research publications indexed in renowned databases such as Web of Science and Scopus, along with contributing 21 book chapters in the same indexing databases. Her contributions to the scientific community have not gone unnoticed, as Dr. Qazi has received 3 prestigious national awards. In 2022, she was honored with the DST Oscar Award, followed her DST Inspire Award in 2019. Additionally, her contributions academic performance was recognized with a gold medal, securing the first position in MSc Bioinformatics in 2019. Dr. Qazi's dedications to the field is further reflections in her involvement in fashionable research and her active participation in national and international conference and her commitment to scholarly research and collaborative endeavors in the scientific community. Dr. Qazi continued to make significant contributions to the field of bioinformatics, leaving an incredible mark on the scientific landscape. Today, we have the privilege of benefiting from Dr. Sahir Qazi's expertise as he shared invaluable insight in the webinar entitled Digital Transformations in Healthcare. We eagerly anticipate the knowledge she will impart and look forward to a stimulating discussions ahead. I truly appreciated my team members for the best effort of research and student training activities. Thank you.
Yeah, ma'am.
Hello. Yes, I'm audible, no?
Yeah, ma'am.
All right.
Yes, ma'am.
So, good evening, all. Thank you so much, Dr. Gopal and your team, for inviting me on this platform this evening so that I can share my idea and experience about digital transformations in healthcare. So, Dr. Gopal, like he has already summarized about the topic, and it was really a well summary about what digital transformations in healthcare are and what is the current scenario globally. So I'll just simply, talk about the topic by giving an example from my own lab, and how it is paving a way for person-centric treatment. So I'll just share my screen with you. Just give me a minute. I hope my screen is visible to all.
Yes, ma'am.
All right, great. So this evening's webinar is on digital transformations in healthcare. And so basically, digital transformation, simply put, if we are not including healthcare right now, just these two words, digital transformation, it simply means the advancement of technology and all the changes, all the transformations that have happened since its advancement in life, in our day-to-day life, right? So digital transformation now in perspective with healthcare, that is what we'll be discussing. So digital transformation in healthcare basically means that it includes all the digital technologies, the processes, data management into all aspects of healthcare delivery and administration. It involves leveraging technologies such as electronic health records. You might have heard of this term. EHR use कर रहे हैं hospitals में, electronic health record use हो रहा है, या electronic medical record use हो रहा है. So EHR is one of the examples of digital transformation that we are employing in every clinical institute today. Apart from that, we have telemedicines, tele-based healthcare, मोबाइल हेल्थ एप्लीकेशंस. आप में से किसके पास स्मार्ट वॉच है? मतलब आई बिलीव सभी लोग स्मार्ट वॉचेस तो पहनते ही हैं. स्मार्ट वॉच है सभी के पास. फिटबिट हो गई या नॉइज, बोट की, बहुत सारी है आजकल तो ब्रांड्स. तो उसमें वो जो स्मार्ट वॉच है उसमें क्या क्या ट्रैक कर लेते हैं आप? ट्रैक हो जाता है ना, जैसे ब्लड बीपी मॉनिटरिंग हो गया, शुगर मॉनिटरिंग हो गया, ऑक्सीजन मॉनिटरिंग हो गया. You can, girls can also monitor menstruation these days.
Heartbeat
is there, right? So
footsteps.
yes, footsteps is there. You can also see calorie intake कितना हुआ है आपका, right? So all these monitoring, this is included in mobile health application. It's one of the healthcare that we are having today. Apart from that, we have several wearable devices. We have AI in medicine. We have data analytics. So all these technologies basically come into your digital transformations in healthcare. तो मुद्दे की बात अगर सिंपल शॉर्ट लेमैन लैंग्वेज में बोले तो डिजिटल ट्रांसफॉर्मेशन हेल्थ केयर का मतलब है टू एम्प्लॉय टेक्नोलॉजी फॉर द बेटरमेंट ऑफ क्लिनिकल एस्पेक्ट्स फॉर पेशेंट्स, फॉर प्रोफेशनल्स, दैट इज योर डॉक्टर्स के लिए भी इजी होना चाहिए, एंड फॉर ओवरऑल हेल्थ केयर ऑर्गेनाइजेशंस, राइट? So today, more and more healthcare providers, they are using digital transformations to make things better for everyone involved. आप आज की डेट में कहीं आप ऑनलाइन अपॉइंटमेंट बुक कर सकते हैं. सो दैट इज अनदर एग्जांपल ऑफ डिजिटल ट्रांसफॉर्मेशन इन हेल्थ केयर. सो कमिंग टू द माइलस्टोन्स नाउ. अभी जैसे सर ने बताया भी है, डॉक्टर गोपाल ने, ही समराइज्ड इट रियली वेल, बट आई विल जस्ट गिव यू अ आइडिया कि हाउ इट स्टार्टेड. हम बोलते हैं digital transformation started back in the the early 21st century, but no, it's nothing like that. The first medical diagnosis that took over a phone, that is telemedicine, it happened in 1897. 18th century में पहला digital transformation अगर देखा जाए 1897 में हुआ था. And phone, if I ask, if anybody is interested to answer, when was the phone invented by Graham Bell? किसको आइडिया है? When was the phone invented?
I guess 1625.
No. Anybody else who would like to give it a try?
Is it 1792?
Little close, but not exactly. You just like read about it कि phone कब हुआ था invent. ठीक है, Graham Bell, Alexander Graham Bell, he was the one who invented phone. We all know that. बस year एक बार आप
1876.
1849 I believe. 1849 में Graham Bell had invented phone, and 1897 में we had first episode of telemedicine. I mean, just look at it. हम लोगों ने पहले ही digital transformations को include कर लिया था अपनी life में, मगर it was not that prominent क्योंकि हर एक के पास phone नहीं था और हमारे पास इतने advancements नहीं थी उस time पे कि हम utilize करें in regular life. Then 1956 में अब हम आ जाते हैं, the first clinical usage of ultrasound imaging. तो इमेजिंग भी जो आज की डेट में इट्स वेरी कॉमन, कोई भी डिजीज है, लेट्स से कैंसर है, ओवेरियन कैंसर है किसी को, यूएसजी तो कराते ही हैं, अल्ट्रासाउंड इमेजिंग इज देयर. सो 1956 में फर्स्ट वी हैड आवर क्लिनिकल यूसेज ऑफ यूएसजीज या इमेजिंग डेटा हमारा 1950s में आया था. And from there, we had several other, milestones that we achieved using technology, using sciences. And now the rest is history because after the completion of the Human Genome Project, uske baad we had we drastically shifted our focus towards tech into medical sciences, tech into clinical sciences and applied sciences. So this is basically the overview, like हमने कहाँ से स्टार्ट किया. एंड डिजिटल ट्रांसफॉर्मेशन इज नॉट न्यू फॉर अस. वी हैव टू अंडरस्टैंड कि डिजिटल ट्रांसफॉर्मेशन 21st सेंचुरी के लिए इट्स नॉट अ न्यू वाइब. ये 18th सेंचुरी से स्टार्ट हुआ था, बट द थिंग इज इट वाज नॉट प्रोमिनेंट देन बिकॉज ज्यादा लोगों में अवेयरनेस भी नहीं थी. So coming to the timeline now, because हम HGP के बाद से ही we consider HGP as the first and foremost episode wherein we, understood what human reference genome is, what all subdomains are there in biological sciences. We have, the omics, genomics, proteomics, metabolomics, so on and so forth. We have bioinformatics now. At bioinformatics se bhi we have shifted towards translational bioinformatics, right? So if we talk about the timeline of the growth of digital healthcare, start to 18th century mein hua tha. The first episode was in 18th century, magar the growth of digital healthcare was after Human Genome Project completion, that is early 2000s mein. So post COVID-19, people, we understood that we cannot do without digital tech. We cannot do without digital transformations in healthcare. COVID का time सभी को याद होगा ना? 2019, 2020 का year. Everybody remembers? We were in a lockdown. We were stuck in our homes, not allowed to go anywhere.
Yes, ma'am.
Remember? कितना मनहूस सा
Yes,
था.
ma'am.
है ना? It was such a bad year, I tell you. कि we were not allowed to go outside. Hospitals तो दूरी हो गए, घूमना भी नहीं, कुछ भी नहीं हो रहा था. We were just stuck. So people and the government, everybody understood that digital transformation in healthcare is due now because you cannot do anything without it. Due to this pandemic's profound impact on healthcare, it actually helped digital transformations to move ahead. And now it's very common for us. Since past 2-3 years, you'll see digital transformation is preferred over the traditional treatment these days. So it's only because कि जब एक pandemic आया, it made us realize that digital healthcare has to be in our day-to-day life. You cannot think your life the way you were thinking in your pre-COVID times. So the crisis, this COVID-19 crisis actually highlighted the need for remote healthcare, for telemedicine, for remote monitoring, for digital health tools to be developed, and to ensure the continuity of care in such unprecedented times. Moreover, we also realize that we think in a very inference-centric manner. What I mean by that is कि आप किसी भी डॉक्टर पे जाते हैं, मान लीजिए आप बीमार हैं and you visit a consultant आपका टेस्ट कराता है, टेस्ट ले लेगा, टेस्ट की रिपोर्ट आती है, वो रिपोर्ट पढ़ता है, then he or she will diagnose कि आपको भाई साहब ये प्रॉब्लम है, ठीक है. मगर ये एक इन्फ्रेंस सेंट्रिक अप्रोच या एक माइंडसेट की तरफ इट हाईलाइट्स कि आप इन्फ्रेंस देख रहे हैं, आप डेटा नहीं देख रहे हैं. यू आर मोर इंटरेस्टेड इन नोइंग कि डिजीज है कि नहीं है. यू आर नॉट इंटरेस्टेड कि डिजीज अगर है या नहीं है, बट डेटा किस टाइप का है. अगर कोई टेस्ट आपने ऐसे कोई रन किया है, व्हाट काइंड ऑफ डेटा इज देयर. Patient का data is a treasure for us. For us, bioinformatician, I being a bioinformatician, data is my treasure. I can play with it all around. So data is very important. And since COVID-19, since this pandemic hit us all, everybody has understood this, that you cannot remain inference-centric. You have to be, your organization, your hospitals have to be data-centric in their mindset and in their procedure of things, right? So this rapid adaptation of digital health जो आप देख रहे हो COVID-19 से, you might have felt कि हम लोग ज़्यादा digital India की तरफ जा रहे हैं. जैसे मोदी जी, who is like PM हमारे हैं country के, he always highlights digital India करना है. We have to be digital in respect to financial status, healthcare, एंड अपने आप को सारा डिजिटल आप ऑटोमेटेड रखो, आप अपडेटेड रखो अपने आप को. तो पेटीएम हो गया, आपकी जो वॉलेट्स भी हैं वो भी क्या है, दैट इज ऑल्सो डिजिटल टेक्नोलॉजी, दैट इज ऑल्सो डिजिटल ट्रांसफॉर्मेशन टुडे. तो हेल्थ केयर में हम क्यों पीछे हटे, राइट? सो दिस वाज बेसिकली कि पैंडेमिक अगर ना आया होता तो हम लोग शायद डिजिटल हेल्थ केयर या डिजिटल ट्रांसफॉर्मेशन की बात ना कर रहे होते. सो व्हेन वी टॉक अबाउट the Indian scenario about the digital healthcare and the transformations, you will see that it is still undergoing rapid transformations. And rapid transformations किस basis पे? There are these factors such as smartphone penetration is there. Now, every day you will see Indian, अगर आप कभी track करेंगे, smartphone users in India, they are increasing every day. Internet, we have improving internet connectivity every day. The government also is, participating in creating this awareness to promote digital healthcare adoption. Government की काफी सारी schemes हैं that you can check out online. PM PMO पे आप जाएंगे तो you will see several awareness camps, several initiatives are there so that you understand, so that people can understand the importance of digital healthcare in India after COVID-19. And I'm again and again telling you, agar COVID-19 nahi aaya hota, we wouldn't have been, so much focused on digital healthcare in India. So, I mean, if you see on the slide 2, there are two different graphs. First one is the India's e-health market is estimated to touch around $10.6 billion by 2025. The reason behind is COVID-19. If you just track it down, let me just open my pointer. Laser pointer, yes. So back then in 2010s, digital market was like 0.2. There was hardly any growth. And after 2019 में हमारा COVID-19 आया, there was slightly better. There was from 0.2 back then in 2010. By 2019, we had a slight growth of 1.5%. And then post COVID-19, you see there is a drastic jump in India's e-health market. So the reason in India's digital healthcare scenario was COVID-19. Agar COVID-19 nahi aata, people wouldn't have realized, the government wouldn't have realized the importance of digitization in healthcare too. Digitization अभी currently financial हमारा तो हो ही रहा है, मगर healthcare में भी अब there are several campaigns, several initiatives that the government of India is taking, and I believe if you can just explore the websites, you will get to know कि कितना सारा ये जो market है digital healthcare का, it's blooming and blossoming every day. So there is basically a 29.6% increase in the CAGR from 2019 to 25, and reason was COVID-19. So अब ये जो digital healthcare है in India, if I tell you, because I work in AIIMS, so AIIMS already has a telemedicine facility. So when we were hit by COVID-19, people who were severely, who had severe diseases, who were cancer patients, they were being consulted using tele-based healthcare. But बाकियों का वहाँ पे उस time पे तो only, urgent cases were being dealt. But today, telemedicine facility in AIIMS, it is functional, fully functional for all the disease, all the patients who are suffering from any kind of problem, not only just cancer or any emergency cases, magar for everybody. If you reside in a remote centric area where you don't have any route to come to AIIMS New Delhi, you can completely consult your consultant who is sitting in AIIMS Delhi from anywhere. So that this is another reason that highlights कि COVID-19 की वजह से we have improved ourselves and we have become more aware towards this topic. So yeah, I mean, this was the Indian digital healthcare scenario. It is still increasing every day. So coming to digital healthcare now, there are 3 different healthcares. I mean, है तो same ही, मगर 3 different terminologies है that we have today in digital healthcare. We have e-healthcare, we have m-healthcare, and we have u-healthcare. Now, e-healthcare simply means electronic health. So electronic health say what I mean by is कि it encompasses your electronic processes and communication tools in healthcare, such as EHR की मैंने बात करी, electronic health records. In majority of the private hospitals that you have in India, every hospital has their own EHR. EHRs basically are computational systems that every hospital has. They register in that EHR, and for every patient, they have their data stored, maintained, and monitored periodically. So apart from that, we also have telemedicine services in e-healthcare. क्योंकि आपका electronic way से you can consult from your consultant. कोई भी clinician, if some clinician wants to speak to you regarding your reports or anything or maybe for a follow-up. So e-health is, using the telemedicine service of e-healthcare, you can do that. The consultant and the patient can do that very easily today. It also facilitates remote consultations. Like I said, आप दूर कहीं रह रहे हैं and you are not able to come in person, तो आप telemedicine के basis पे you can consult your clinician. And again, the benefit of e-health today is patient data management. Everything is being saved, stored, managed periodically. सारी maintenance भी हो रही है periodically. So some common examples that you can check online for e-health is My Health Record, and there is Qazi's permanent online health portal. So ये तो open access हैं, जिनका example I have just mentioned on the slide. But EHR for different hospitals are very private. वो उनके अपने system में होता है. Coming to M-Health now. Now M-Health simply is mobile health. Mobile health नाम इसलिए पड़ा है क्योंकि person can track their own health using their mobile device or their tablet. सभी के पास मोबाइल है. I believe सभी यहाँ पे जो भी हैं, हम लोग जो सेशन में हैं online present, everybody has a mobile, a smartphone. Everybody has smart watches, right? You may have your Fitbit, Google Fit, some Samsung healthcare application is also there. So on your phone, you have all these applications through which you can track भाई मैं कितना steps चला हूँ पूरा दिन में, या you can track your BP, your sugar, so on and so forth. So mobile health, M-Health basically helps a person to track their own healthcare. They can manage, monitor their own healthcare without any consultation from their clinician. उसमें consultation की requirement नहीं होती है. That is what M-Health means. So if you have your smartphone, if you have a watch, if you have any sensor, biosensor maybe, so you can track your own healthcare. There are several health tracking apps. You have medication reminder apps these days. You have teleconsultation applications that you can access through your phone. You don't have to do anything. You don't have to, just jump onto anything. Phone hai, phone mein application hai. If you have downloaded that, you are good to go. So that is what your M Health means. And some examples of health, M Health is Fitbit, Google Fit, Samsung Health, Dafit is another one. So there are several applications today. If you go to your Google Play Store, you can find n number of applications that you can download free of cost. Now coming to this U Health. U Health means ubiquitous healthcare. Now if I ask ubiquitous ka matlab kya hota hai, just in a layman language, what do you understand by this term ubiquitous? Anybody? Ubiquitous ka meaning kya hai in a very general sense? What do you mean by ubiquitous?
Something that is found everywhere.
Yes. Something that's omnipresent everywhere. Exactly. So U Health simply combines this E Health and M Health. That is what U Health is. Matlab E Health, electronic health plus mobile health is equals to U Health. Why I say that? Because ubiquitous healthcare can be implemented by the use of your own body area network ke basis pe. It will track, it will monitor, it will send the report to your doctor. You don't have to go anywhere. Aap bas chalte rahe, you do your own job, and U Health will take care of your health. U Health has that potential to to take the samples from your from the signals. Maybe you are wearing a smartwatch, maybe you have some biosensor that you have installed in your body. So directly using those data, that data will be processed and it will be sent to the clinician. Clinician will then further send his or her remarks, whatever it is, to you. So it's that easy. So U Healthcare basically what it does is it extends beyond traditional healthcare. जैसे पुराने जमाने में आपको डॉक्टर के पास जाना ही होता था in order to get a test done. You had to visit a clinic to take your report back. आज की डेट में ईमेल हो जाता है आपके पास या फोन पे आ जाते हैं आपके रिपोर्ट. You can download it easily. So U Healthcare is basically E Healthcare plus M Healthcare. And it's very personalized, it's easy to use, and basically it is context-aware healthcare that helps any patient, any person, any normal individual to track their healthcare. And U Healthcare is also called as modern healthcare. Magar I don't prefer modern health as a terminology. U Healthcare is a better term to justify the technique. So this slide here, you can see I have just pasted a snap of my health record. That is one of the best examples online of electronic healthcare. So EHR jiski baat kar rahi thi main, what you can do is you can just explore this myhealthrecord.com. You can register yourself on this and you can track your health. If your consultant too is on this application, on this EHR, they can view your records, they can view the medications, appointments, follow-ups, so on and so forth. So EHR ke basis pe, it's, it makes everything very easy. It makes healthcare monitoring and management very easy. Now coming to the example of mobile healthcare. Now this is the snapshot of a Fitbit. The number of steps that you have walked in a day. You can see how many exercises you have done since past 5 days, like 3 days out of 5 you have exercised. Sleeping cycle you can track. You can track how many miles you have walked, floors, how many floors you have, stepped on, so on and so forth. And the calories that you have burnt. So this is more of a personalized healthcare management and monitoring that we are doing. Ab awareness ki baat hoti hai. I have seen people, I tell you one example. I have seen people who buy watches who are like they have this craze of buying a smartwatch, magar they don't know why they are wearing one. So smartwatch ka civic fashion statement nahi, it's not just a fashion statement, but you have to track your healthcare. It's that easy. You don't have to consult every time. कभी बीपी आपका अगर है, शुगर मॉनिटरिंग है, ऑक्सीजन मीटर होता है already available. There are so many parameters, so many plug-ons that are available today in your smartwatch that you can utilize. So yeah, that's that. Now coming to example of ubiquitous or U healthcare. Now, like I said, ubiquitous healthcare basically is when you have electronic healthcare with your mobile healthcare. You are, suppose, let's say you wake up in the morning, you go for a jog, okay, you are wearing your motion sensor, you are wearing your smartwatch, and all the sensors, the motion sensors, the way you are jogging or walking, whatever, all that information will be stored in your phone because you have that application that works with your smartwatch, right? So this phone, your smartphone, will act as a bridge, and this application will send the processed data that has been taken from the sensors to internet. That's e-healthcare. And that way, your information will be sent to maybe the emergency, to your clinician, to your medical server, so on and so forth. So this is how your mobile health and your electronic health works hand in hand in ubiquitous healthcare. And ubiquitous healthcare ही आज की generation में हम लोग U health में जी रहे हैं. So this time, since past 3 to 4 years, we are in the era of ubiquitous healthcare. So ubiquitous healthcare can be tagged as healthcare anytime, anywhere. Okay, so that's the benefit of U-Health. So coming to the digital transformations in healthcare. Now, a new prescription for a change. Why are we saying a new prescription for a change? Reason behind is that there is this paradigm shift that we are seeing now since post-COVID. So, healthcare has changed. The meaning of healthcare has changed completely. Healthcare, the way it is delivered, it's managed, it's experienced, everything has changed. Our mindset has changed. Our perception towards the word healthcare has changed. With the rapid advancement of digital technologies, healthcare organizations are embracing innovative solutions to improve patient outcomes. You have this idea of operational efficiency. Initially, or maybe we can say, if we just hark back in the time, early 90s there was no idea of interoperability. This term is very important. Reason behind interoperability ka matlab hota hai when you are operating different domains, when different domains come together to make one prescription for you, one diagnosis for a patient. Cancer, since I have worked on cancer, I'll cite that example. Cancer maybe agar kisi patient ko hota hai, if koi bhi patient aa raha hai, so there will be a board of consultants that will be sitting. Not just one consultant, but at least 4 to 5 consultants. One will be the diagnosis, the main consultant who's seeing the patient. Second one will be the radiologist, जिसने टेस्ट किया होगा, radiological scans के लिए biopsy हो गई, CT हो गई, mammo हो गया, कोई भी, so on and so forth. Third one will be the pathologist, histopath की जो report बनाता है, right? Fourth one will be some, let's say if the hospital is having a CDSS support, so an AI expert will be sitting. So all these 4-5 members, all these 4-5 clinicians, they will be working on one patient for giving a better diagnosis and prognosis for that patient. So in this way, in this manner, diseases are being effectively treated. Personalized medicine is one of the concepts that it started back then in 2013 in the USA when Barack Obama, he introduced this term. And now in India too, we are seeing the highlights of person-centric platforms for cancers, for neurological diseases, and also for cardiological diseases. So basically, from electronic healthcare and telemedicine to artificial intelligence. आज की date में we are talking about artificial intelligence in medicine, where we have smart biosensors, we have wearable devices. So the landscape of healthcare has been, it's being reshaped and reshaped by digital innovations. That's how there is this paradigm shift. That's how we have a new prescription for change in healthcare. And all this, what does it do? It enables personalized medicine, person-centric platforms. It helps people for a proactive health management. It is more of data-driven rather than inference-driven. And it helps further in decision-making, a robust decision-making for a patient. So with all these pros, we still have some cons, such as we have, we have several challenges, such as data privacy. Last year, back then in August, September, AIIMS had a server attack. Do you guys know about it? It was all in the media last year. AIIMS cyber attack by some Chinese group. Heard about the news? Nobody? Hello?
No, ma'am.
Okay. So last year AIIMS पे cyber attack हुआ था, due to which बहुत सारा patient का, although patient data was not lost, मगर it still haunted us कि what if अगर हो जाता तो क्या करते. So बहुत सारी चीजें हैं that you have to keep in mind before you hop on to digital transformation in healthcare. You have to be committed towards, the patient privacy. The privacy is first and foremost, crucial point that any hospital, any clinician, any clinical setting has to take up. Apart from that, there has to be equitable access to digital health solution. ऐसा नहीं होना चाहिए कि कोई भी, any random person is utilizing EHR. You cannot do that. The person who is well trained, who is well educated in regard to EHR, how to manage an EHR, how to manage telemedicine platforms, only those people should be given access to such digital platforms. Ultimately, digital transformation in healthcare, it also offers, several, although we have more of pros instead of cons, but still we have to keep it in our heads that anything can happen anytime, because cybersecurity is one of the major challenges today that we all are facing. AIIMS ka cyber attack is one of the examples that we have to keep in mind. Now, coming to like the 5 essential components of digital transformation, like I said, previously our hospitals, our clinicians, they were inference-centric. The organizations were more of inference-centric instead of data-centric. So since the advancement of digital transformations in healthcare has happened in India, we are becoming more data-centric. We want data, we analyze data, we store data, we manage data, and we track how things are working, how we can better our healthcare platforms, how we can better our, the prediction, the prognosis of diseases, how we can tailor more person-centric treatment plans for people. So that is what it is. And digitization, analytics, and operations, these are the 3 main pillars if you are talking about digital transformations. Digitization basically is when you convert the analog information and processes into digital formats. That means if you are wearing some wearable device, you are tracking your own healthcare, and that data is being recorded. And that data further gets into, it further gets processed and analyzed by experts. Because again, we are living in a healthcare environment, ubiquitous healthcare hai. So aapka jo data generate ho raha hai, it is being shared with your consultant only. So the consultant will see, analyze, and accordingly will take an action. And that action will be further operational in such a way that your prognosis, your treatment plan will be planned in such a way that it will be targeting only the region of interest. Jo target site hogi aapki, problem site jo hogi, only that will be targeted. So it is more of a person-centric area, no? So you don't have to worry about if there will be any privacy breach, data leak हो गया, कुछ नहीं होगा, क्योंकि हमारा जो cyber cell है India में भी, and several hospitals, several private hospitals especially, they take care of that. And this digitized data that basically we are taking from your wearables, from your smartwatches, from your mobile phones, from EHRs, all this data serves as the foundation for analytics. Now, analytics we are using machine learning, we are using predictive analytics, and all this is applied to derive actionable insights. So action तभी लिया जाएगा when we are getting a good data, when we are getting real-time data. And all this data is being processed using machine learning, deep learning, AI techniques. So these are basically the digital healthcare trends that we have. And as you can see, majority of them you already know, I guess. So the trends today combine a variety of innovations and advancements aimed at enhancing patient care. ये सारी जो चीजें हो रही हैं, it's only to enhance, to improve patient care. Patient healthcare is the first and foremost priority for any healthcare institution, and that is why digital transformation is also giving its support to that. Telemedicine continues to experience, जिसको हम telemedicine कह रहे हैं, telemedicine too has several subcategories that I'll be showing in my next slide. So telemedicine, tele-based healthcare, it continues to experience significant growth. We are still improving our tele-based healthcare platforms. And with increased adoption of virtual consultations, because the more you are consulting with your doctor virtually, the better our platform is becoming. And remote sensing, remote monitoring services are also being, they are also being improved. Artificial intelligence and machine learning, you are using that so that, you can analyze the data. Like I said in the previous, if I just hop on to the previous slide, your analytics basically includes machine learning, AI, in order to do a predictive analytics so that we can get insights exactly what the problem is and where there is this problem, and so that we can fix it up. Apart from that, we have personalized medicine, clinical decision support system. Blockchain is for the cybersecurity. Like I said, privacy breach बहुत होती है, it happens, and it is one of the challenging areas that we have to take care. So that is that. Big data reason is every hospital, every clinic, छोटा से छोटा, बड़ा से बड़ा, everybody is generating data in an enormous rate. Gigantic data is medical data is being generated every minute. So that has to be monitored, that has to be stored in such a way so that we can do our analysis, so that we can come to a conclusion for a better healthcare strategy. Wearable devices, mobile health applications, medical IoT, all that is becoming integral to treat diseases, to manage our healthcare, to empower individuals to track their own health. क्योंकि health metrics आज की डेट में बच्चा कर पा रहा है अपना health, track कर पा रहा है. So that is where medical IoT is being taken care of. And to manage chronic diseases, to see whether you are engaging in proactive wellnesses or not, you have that, that power in your hand that you can see, and you can help yourself, you can improve your lifestyle. Sedentary lifestyle में है तो you have that option कि आप अपने आप को track करके अपनी health को, wellness को you can track and improve your schedule. Additionally, there is a growing focus on interoperability. These branches that I am showcasing here on the slide, these are interoperable. And data exchange is one of the things that helps digital transformation in healthcare. It helps to facilitate seamless sharing of healthcare information for every patient, for every individual across different systems. Telemedicine ka jo data hoga, it will be shared with all these subdomains for one person, for one individual. And all this, what will this do? It basically enables more coordinated and patient-centric care for any disease, for any individual. Now, coming to tele-based healthcare, because this is one of the most important subfields of digital transformations in healthcare in India that we are focusing on. So tele-based healthcare is also called as telehealthcare, telemedicine. We have several synonyms for this term. It basically refers to the delivery of healthcare services, information, education remotely using telecommunications and digital technology. There are several subfields, subcategories of tele-based services that we have in India today. Telediagnosis, teleconsultation, telenursing, telerehabilitation, telemedicine, teletreatment, telepsychiatry, teleoncology is also there, so on and so forth. And these tele-based, healthcare encompasses wide range of services. It includes real-time video consultation, telephonic consultations, remote patient monitoring using wearable devices. जैसे कहा कि स्मार्ट वॉच अगर आपने पहन रखी है, आपका वो सारा डेटा जो है वो आपके कंसल्टेंट के साथ शेयर हो जाएगा, in real time. And it also helps in secure messaging platforms. मान लीजिए if you are unable to speak to your consultant over the phone or the video, you have the messaging option too in tele-based healthcare platforms, particularly for individuals जिनके यहाँ पे टावर नहीं आता, जहाँ पे सिग्नल नहीं आता. तो remotely रह रहे होंगे, जो underserved areas में रह रहे हैं, they can use tele-based healthcare. And also, if you look at it in this way, it offers convenience. No, it's not like you have to wait for the consultant. You have to wait in long queues for your consultation, for your for maybe anything. So you don't have to do all that जो conventionally होता था पहले. At at your own convenience, at your own flexibility, at your feasibility of your consultant, you can track your healthcare, you can monitor it. And it's also, I must point it out, it's cost effective. Tele-based healthcare platforms, they are all cost effective and they maintain the quality care. It's ऐसा नहीं है कि you will not get the same consultation the way you are getting in offline mode, but quality is there. It's cost effective, it's better, it's convenient, easy to use, and it ensures patient confidentiality. That's the most important point that is present in all the tele-based healthcare services that we have today in India. So I'll just give one example of digital transformation from my own lab, like I said before I started off with my presentation. So with the collaboration of CDAC Pune, we have developed India's first electronic healthcare, electronic medical record, and clinical decision support system platform called as ioncology.ai. That was basically funded by MeitY Government of India. Now this I in ioncology stands for integrated, as it encompasses the potential of AI models for breast and ovarian cancer early detection and clinical assistance to consultants, radiologists, pathologists, researchers, and AI expert. We developed ioncology.ai platform because this platform will actually allow any consultant to data collection, with the data collection, collation, analysis of clinical data. This platform is especially dedicated for capturing oncology-related clinical data. And it's equipped with AI models, deep learning models that will assist any clinician in cancer diagnostics and therapeutics. So this is how the web interface of ioncology.ai looks like. It's now accessible on AIIMS network. Initially, we were using VPN to connect to it, but now it's on AIIMS network, and very soon it will be globally accessible for other clinicians too. I'll just remove this. Wait, I'll keep it here somewhere. Yeah. So when a doctor will log into this ioncology.ai platform, this is how the dashboard will look like. There are 4 modules in ioncology.ai. First is the organization and user registration, where the patient will be registered. Then we have case paper, that is basically the electronic health record, wherein the data entry operator or the clinician will be adding and modifying the data for the patient, the follow-up, visits, the medical history, investigation, so on and so forth. We have the case pro forma for breast and ovarian cancer. And finally, we have this plugin of AI modeling. So the developed models, like I said, we have used deep learning models in ioncology.ai platform. We have developed 6 different models. And these 6 deep learning based models are embedded in ioncology.ai platform. Each of these AI models basically is image specific for classification, for tumor detection, for disease prediction, for breast and ovarian cancers. So all these 6 models were basically tested with AIIMS patient. Post its development, we tested these models with the AIIMS patient data. And around 5 lakh images were used. And what we observed was that the accuracy scores of all these models were like, it was above 89.5%. So with this good prediction, and since it was user-friendly, so the government of India, METI, they suggested us to install the platform in other departments of AIIMS hospital and for further clinical evaluation, so that we can just get an idea what exactly, how exactly it is working, and whether we are able to use it as an EHR and a CDSS or not. So with a good response from clinicians from AIIMS, we were further asked to install it in several other government hospitals. So thus, on 13th of January this year, we installed ioncology.ai platform in Dr. Sheila Sharma Memorial Hospital. It is basically a cancer hospital in Mathura. And it was installed there. And post its installation, we moved and installed the developed platform in 5 government district hospitals of states, Madhya Pradesh, Gujarat, Rajasthan, and Uttar Pradesh. So currently it has been installed in around 6 or 7 hospitals. Our efforts have been lauded and recognized, and several national print media such as the Hindu, the Indian Express, Dainik Bhaskar, Punjab Kesari, etc., they have highlighted our ioncology.ai platform. I have just pasted a few media snaps here. Well, quite recently, Dr. Mansukh Mandviya ji, who is the Minister of Health and Family Welfare, he also tweeted about our, ioncology.ai platform and congratulated both the teams from AIIMS New Delhi and CDAC Pune on the development of India's first integrated electronic health record, electronic medical record, and clinical decision support system. ये इंडिया का फर्स्ट ऐसा सिस्टम है ioncology.ai जहां पे आपको तीनों चीजें इंटीग्रेटेड मिलेंगी, तो कहीं आपको अलग टूल भी यूज नहीं करना है, EHR भी है, EMR भी है, और AI बेस्ड क्लिनिकल डिसीजन सपोर्ट सिस्टम भी अब क्लिनिशियंस को मिल जाएगा. So this is our team. I just wanted to show you like the teams behind ioncology.ai who have worked dexterously on this platform, and we believe that teamwork is important than individual hard work. For us, team is basically together everyone achieves more. Last year in New Age Technology Show theme of India International Science Festival that was held in Bhopal, we won the Best Poster Award for ioncology.ai prototype, wherein we displayed the system workflow and how the AI-backed platform... Hello? Shall I continue?
Continue, ma'am.
Yes. So we basically displayed the system workflow and how the AI-backed platform will be beneficial for consultants diagnosing gynecological cancers. Currently, it's only for ovarian and breast cancer, but we are also working on including oral cancer too, and lung cancer too. So this is about the last year that we displayed our posters and our prototype. And this year, we demonstrated the fully functional ioncology.ai platform to consultants, again in NATS of India International Science Festival. And it was lauded by everyone, actually. So because this is a novel concept for India, and that too, it's an AIIMS product, so it was further recognized and appreciated. So oncology.ai platform is one such example of how digital transformation in healthcare has enabled a paradigm shift as it can analyze vast amount of patient data, including genetic information, treatment outcomes. It can tailor treatment plans for clinicians in order to assess them with the diagnosis and prognosis of the breast cancer, ovarian cancer. It can also improve the effectiveness of cancer treatments as we have incorporated AI models that can predict and detect the tumor. If there are several images wherein the consultant cannot be sure कि tumor है कि नहीं है, ट्यूमर दिखता ही नहीं है, काफी सारी टेस्ट आप देखोगे CTs में, एक्सरेज में, मैमोग्राम्स में, you cannot find it using your naked eyes. That is where AI can help you and assist you. So our platform AIoncology.ai can analyze medical images such as radiological scans to assist in early detection and diagnosis of breast and ovarian cancers. This can lead to earlier intervention, improved prognosis that can further help patients and clinicians both. AIoncology.ai can facilitate the integration of diverse sources. EHR, like I said, it includes your EHR, EMR, and CDSs. So basically, it's more of a holistic platform that can help clinicians in better diagnosis, prognosis of diseases. So I'll just conclude by saying one line that we can fight against cancer because cancer is one of the burdens of India. And digital transformation can help us win the fight. आपको मैं बता दूं कि कैंसर जो बर्डन है अभी इंडिया पे, कैंसर के साथ साथ आपका हार्ट डिजीजेस, कार्डियोलॉजिकल डिजीजेस is another burden that we have in India today. Annual death rate is like increasing every year for both the cancers and for cardiological diseases, and that is how we should ponder upon bringing digital transformations in healthcare so that we can diagnose and prognose and further finally plan the treatment accordingly, because person-centric treatments are better rather than tailor-made treatments. Thank you so much. I'll just stop sharing now. If you have any queries, you can just ask.
Thank you, ma'am. It's an excellent presentation.
Thank you, sir.
Yeah, we learn a lot for this presentations also. Digital transform really booming field for this right now to the patient cure and to the diagnose also. It's a wonderful presentations, and I appreciate it to things. Each and every slides is a very informative sessions for that. And the students, this is open for these questions. Anyone to any questions for this? So you ask to that.
Ayush Kumar, you have raised your hand.
Good evening, ma'am.
Please go ahead.
As a biotechnology student, I wanted to ask you that how can we implement the use of bioinformatics in the field of healthcare, clinical healthcare, apart from databases?
See, bioinformatics का ये बहुत ही बड़ा एक मतलब I'll say एक tag लगा है कि only we deal with databases. No, we analyze data. Databases is one of the modes through which we can track data, we can record, we can retrieve data. However, as a bioinformatician, you have the capacity to analyze data in n number of ways. Be it genetic, epigenetic, proteomics कर लो, metabolomics कर लो, pathway signaling cycles आप देख सकते हो, you can track that. And all these information, all the genetic information, the epigenetic, proteomic, all the omic information will aid in diagnosis of diseases. AIoncology का जैसे अभी मैंने आपको example बताया है. Currently, if you use it, क्योंकि in the near future, maybe by the end of this year, every hospital will have AIoncology.ai in their hospitals. So every clinician will have that potential to utilize statistical analysis, to utilize bioinformatic tools and packages to analyze patient data. क्योंकि जब तक genetic framework आपको पता नहीं होगा, you cannot diagnose diseases in better way. Genetic framework पता होगा आपको, only then you will be able to analyze and detect कि आपकी कोई genetic several patterns are there that can help कि एक novel biomarker आपको किसी disease का मिल जाए. So all that can be done through bioinformatic pipelines. And सिर्फ database नहीं है, database is just a repository, a mode जहाँ से आप data को retrieve कर सकते हैं. Currently, जैसे NCBI is one of the repositories, you have EMBL, you have DDBJ. All these are 3 different repositories of bioinformatics. Unme bhi we have several databases that will give you n type of information, n type of data. Jaise GenBank is there, right? So GenBank mein aapko faster information mil jati hai, nucleotide information milti hai. You have UniProt, you have SwissProt, so on and so forth. So different type of data can be realized for different purposes. And clinical, agar aap clinical aspect mein pooch rahe ho, so definitely bioinformatics helps in clinical analysis and pipelines. I hope I answered your query.
Yes, ma'am. Thank you.
Now, one question from my side.
Yes, sir.
So, what are the current application of AI oncology research and clinical applications, clinical practice?
Yes, sir. So basically, we thought of developing. Abhi currently, agar aap पूछेंगे, what is the best EHR available globally for cancers? There is only one, unfortunately, and that too in United Kingdom. That's called as Onco EHR or something. So that platform only has the potential to collect the data of patients. You can collect, you can see and track. That is it. That is what it can do. iOncology.ai, on the other hand, first and foremost, India ka hai. It's made in India. Second, it has the potential to collect your data. It has the potential to analyze your data. It will also help in any clinician if they want to see, if they want to check the accuracy ki tumor hai ki nahi hai in cancers, they can do that. So it is not only acting as an EHR, electronic health record to hai hi. However, it is also working as a clinical decision support system. It is working as a bot, an AI empowered bot for clinicians, so that they can see and they can, confirm whether there is disease or not, whether there is a benign tumor or a malignant one. So that is the potential of iOncology.ai. So clinical aspect mein currently, like I said, it's only for breast and ovarian. Breast and ovarian mein we are getting, sir, these 2 malignancies na India mein, this is very common. औरतों में breast cancer, ovarian cancer से ही death हो रही है annually. I am sure you know about the statistics. So अभी के लिए हम लोगों ने ये सोचा है कि gynecological malignancies के साथ we can start. And because our model, our platform is able to give treatment plans too. Chemotherapeutic कौन सी medications use होंगी. Our platform has that option कि वो AI base पे patient to patient person-centric treatment plan भी charter करता है for clinicians. So that is another application that I think कि oncology में है जो अभी तक कहीं पर globally आपको मिलेगा नहीं.
Okay. So what is the key challenges? Key challenges for barrier for implementing digital transformation?
So the key challenge is people don't trust. I mean, doctors don't trust artificial intelligence at all. They are like, privacy का क्या होगा, data हमारा चुरा लिया तो क्या होगा, data हम क्यों share करें, all that. So there is this stiff that is there, and I hope कि ये जितना ज़्यादा awareness होगा लोगों के बीच में, this stiff will also vanish. So that is one. Another challenge that I feel in iOncology or the adaptation of this digital transformation in healthcare in India is awareness and education. Majority of the people, they lack digital literacy. Yes. That is another limitation that I feel. So until and unless government, although government has initiatives that, they have started awareing people about all these platforms, about the digital platforms that are available in India and digitization again. So I think if we are able to conquer that digital illiteracy, we'll be able to see better results in the coming future.
But AI improve the early detection of diagnostic cancer?
No, sir, I won't say that AI will detect cancers. I mean, it is detecting. However, a consultant will always be on the top tier of the pyramid. If AI is the base, the consultant will always be on the top. So the final decision will be made by the consultant. कुछ लोगों को तो सर I'll tell you ये एम्स में ऐसा हुआ है सर कि they are afraid कि हमारी जॉब चली जाएगी because AI is here. But I'll just say that AI will give you an idea. It will just give you a direction कि cancer है कि नहीं है, tumor है कि नहीं है, कहाँ localized है. That is it. The final call is yours because you are experienced. A consultant is experienced, so they'll have to take the call. So yeah, that is that.
Okay. Any questions from audience sides?
Actually, ma'am, I wanted to ask something.
Yes.
Actually, ma'am, is there any tool, like maybe in the future we can predict like if this person is going to have cancer or not by using AI or some other tools? Is it possible, like maybe not now, maybe after 5 or 10 years?
iOncology आ गया है ना, 5 to 10 years क्यों wait करना है? You can use that iOncology. AI in our platform, we have that potential. You can detect whether there is cancer or not, whether that patient has a benign tumor, malignant tumor. You can use that. The reason there you cannot have a tool for this. I mean, you'll have to utilize a platform, an AI-empowered platform. And these platforms basically are only accessible to healthcare institutions. That is one. On a personal level, I'll say that you can utilize bioinformatics pipelines, you can utilize machine learning in order to prepare some tools, some packages that can help and assist, that can be embedded in such platforms, HR platforms. Let's say iOncology, if you have any idea, you can develop one package, you can develop some plug-on, and we can embed that. And that will assist in non-clinicians, academicians, researchers who are interested in knowing and predicting cancers early. That can be done.
Thank you, ma'am. Ma'am, I have another question, if you allow me.
Yes, please.
Ma'am, just like COVID, like it happened, like we didn't had any idea like the COVID is happening, and we literally had no treatment for that. So is it possible maybe in the future, if there is any like more dangerous virus than COVID, maybe we can predict, analyze or predict some kind of like treatment for that using this method?
Yes. I mean, COVID agar nahi aaya hota na, people wouldn't have woken up. They were in deep slumber, researchers especially. So COVID aaya, it was like a blessing in disguise for us, for people like you and I, that now we are thinking in this direction. Pehli baat honi chahiye ki think up. You have to think first, and only then you will be able to do and analyze the situation. So like you just asked, we had several techniques, we had several models, actually mathematical models that were there, that were utilized to predict ki infections kahan hoga, transmission hoga ki nahi for COVID. Abhi bhi post COVID now, we have several models too. We have several hybrid models actually that are being used to predict the transmission, to predict the the infection rate hai ki nahi hai, infection hoga, kab hoga, kyun hoga. All such things can be done, can be they can be predicted beforehand. But all this basically ये बहुत ही छोटे stretch के जो लोग होते हैं ना, जो researchers हैं, who work in machine learning, who work in mathematical sciences and have an interest in biological sciences, only they have the that idea of how to utilize this power. So ऐसा नहीं है कि कोविड के टाइम पे we didn't have any tool, we didn't have any idea of where will it hit next. We had several models, मगर वो models की जो information होती है, it was not tested. We didn't have any validated data कि यार अगर if we are utilizing so and so model तो ये infection होगा ही होगा. However, now since past 3 years, 4 years, we have several validated data sets. We have validated models that are being used to predict for COVID के भी आज भी cases आ रहे हैं. ऐसा नहीं कि COVID-19 is vanished. It's nothing like that. We have COVID cases today. मगर वो जब prediction होती है ना, prediction score अब इतना better हो गया है हमारी country के लिए, in our country's aspect, कि अब we can predict COVID कब होगा, किस area में ज़्यादा risk है for transmission, and ये सारी चीजें अब आज की date में predict कर सकते हैं.
वाओ मैम, दैट्स लाइक मैं ये नहीं जानता था एक्चुअली, बट बहुत अच्छा लगा ये सुन के कि हम लोग का मतलब डेवलपमेंट हो रहा है ये फील्ड में, बहुत अच्छा. थैंक यू सो मच मैम फॉर आंसरिंग माय क्वेश्चन.
Thank you. Yes, Mohammed Sahil Hashmi.
Yes, ma'am.
Yes.
Ma'am, I want to ask that being a bioinformatics student, what are the key skills and competencies that bioinformatics students should develop to contribute effectively to the ongoing digital transformation in healthcare?
Well, Sahil, see, skill set से important होता है if you know what you are doing. I mean, this is my own idea. मेरा बायोइन्फॉर्मेटिक्स में पूरा पोस्ट ग्रेजुएशन रहा है, फिर पीएचडी रहा है, मगर आई थिंक कि अगर आपका स्किल सेट से ज्यादा अगर आपको पता है कि आप क्यों कर रहे हैं, क्या कर रहे हैं, ये दो चीजें अगर आपको पता है तो नथिंग कैन स्टॉप यू एंड यू विल फिट इन एनी फील्ड. अब रिगार्डिंग योर क्वेश्चन कि क्या स्किल सेट होनी चाहिए, इफ यू आर गुड विद प्रोग्रामिंग with R, with Python, क्योंकि these two programming languages are a must for bioinformatician. अगर आपको कोई अपनी prediction करनी है, कोई tool बनाना है, package करना है, या कोई भी other analysis that you have to do, you have to be well versed with these two programming languages. Apart from that, please be updated with all biological papers. बहुत सारे manuscripts आते हैं जो भी आपकी research of interest है. Let's say if you are interested in COVID-19 or any infectious disease, you should read one paper every day in order to be updated कि what is the scenario, what is the current, what is the current happenings in that field. मैं I have worked in cancers, my PhD was in ovarian cancer, so I still have this habit of reading one manuscript every day in order to be updated what is happening. क्योंकि जब तक आपको रिसर्च, लिटरेचर रिसर्च का पता नहीं होगा ना, what is happening in the academia market, you won't be able to track how you can contribute to the society in that particular subject. So programming is there, and second thing is update आपको होना चाहिए. You have to be well versed with what is happening in literature. The stronger the literature recapitulation you do, the better you will be able to track and analyze things. अगर आपकी literature मान लीजिए, if you don't have any idea, paper आप पढ़ते नहीं है, आपको idea नहीं है कि क्या चल रहा है, कहाँ पे रिसर्च गैप्स कितनी हैं, सो वो फिर चलेगा नहीं, क्योंकि आप जो काम कर रहे होगे किसी और ने ऑलरेडी पब्लिश किया होगा वो पेपर, तो दैट इज लाइक वेस्ट ऑफ टाइम, नो, वेस्ट ऑफ एनर्जी. सो पहले आपको पता होना चाहिए चल क्या रहा है, मार्केट में क्या चल रहा है, हाउ आई कैन कॉन्ट्रीब्यूट इन रिसर्च गैप. जो लिमिटेशंस आज भी हैं, देयर आर सेवरल करंट चैलेंजेस इन बायोइन्फॉर्मेटिक्स टू जो अभी तक हम लोग रिजॉल्व नहीं कर पाए हैं. One being, we are unable to, अगर देखें तो epigenetic landscapes जो हैं disease के लिए, किसी भी disease में जो landscape होता है, genetic landscape, we don't have that yet. Bioinformatics का काम होता है that you have to analyze data, you predict some genes, predict proteins that are triggering in so and so cancer या any other disease. तो जब डेटा ही आपके पास इंफॉर्मेशन नहीं है पूरी, यू हैव नॉट माइंड योर डेटा वेल, हाउ विल यू बी एबल टू से और सजेस्ट कि ये डिजीज में ये प्रॉब्लम हो रही है और दिस इज द नोवल कैंसर कॉजिंग और डिजीज कॉजिंग जीन, ट्रांसक्रिप्शन फैक्टर, मेटाबोलाइट, प्रोटीन, एनीथिंग, any genetic entity, any biological entity that is causing that disease. So ये सारी information अगर आपको नहीं होगी, if you are unable to do that, तो चलेगा नहीं काम. तो मेरा तो यही मंत्रा है कि एवरी डे वन पेपर एंड प्रोग्रामिंग स्किल्स को आप अपडेट करते रहो, तो यू आर गुड टू गो. बायोइन्फॉर्मेटिक्स हो जाएगी इतने में.